Anxiety disorders are a global concern affecting millions of people worldwide. In fact, they're the most common mental health disorders, yet many remain untreated. This is a critical issue that deserves our attention and understanding. Anxiety, more than just worries. Anxiety disorders are not just about feeling a bit nervous or worried. People with these disorders experience intense and excessive fear and worry that can be overwhelming and difficult to control. This often leads to physical tension, cognitive challenges, and behavioral changes that interfere with daily life. The impact of anxiety disorders is significant. They can affect a person's ability to function in various aspects of life, including family, social, and work or school environments. It's a serious condition that requires our awareness and support. The numbers don't lie. In 2021, an estimated 359 million people worldwide were living with anxiety disorders. This represents a substantial portion of the global population, with approximately 4.4% currently experiencing an anxiety disorder. However, here's where it gets controversial. Despite the availability of highly effective treatments, only about 1 in 4 people with anxiety disorders receive any form of treatment. This treatment gap is influenced by several factors, including a lack of awareness that anxiety is a treatable condition, insufficient investment in mental health services, a shortage of trained healthcare providers, and the stigma associated with mental health issues. Symptoms and patterns. Anxiety disorders can manifest in various ways. Some people may experience excessive fear or worry about specific situations, such as social interactions or panic attacks. Others may have generalized anxiety disorder, where they worry about a broad range of everyday situations. These symptoms typically persist for extended periods, often several months or more. Other common symptoms include trouble concentrating, feeling irritable or restless, physical issues like nausea or heart palpitations, and difficulty sleeping. People with anxiety disorders may also feel a sense of impending danger or doom. Anxiety disorders can increase the risk of depression and substance use disorders, as well as suicidal thoughts and behaviors. It's a complex web of interconnected issues that require careful attention and management. Types of anxiety disorders. There are several distinct types of anxiety disorders, each with its own unique characteristics. Generalized anxiety disorder. Persistent and excessive worry about daily activities or events. Panic disorder. Recurrent panic attacks and fear of future attacks. Social anxiety disorder. High levels of fear and worry about social situations, often leading to feelings of humiliation or embarrassment. Agoraphobia. Excessive fear and avoidance of situations that might cause panic or feelings of being trapped or helpless. Separation anxiety disorder. Excessive fear or worry about being separated from loved ones. Specific phobias. Intense, irrational fears of specific objects or situations that lead to avoidance behavior. Selective mutism. Inability to speak in certain social situations, primarily affecting children. It's not uncommon for people to experience more than one type of anxiety disorder simultaneously. Symptoms often begin in childhood or adolescence and can persist into adulthood. Interestingly, women are more likely to experience anxiety disorders than men. Understanding the causes and prevention. Anxiety disorders, like other mental health conditions, are the result of a complex interplay between social, psychological, and biological factors. Anyone can develop an anxiety disorder, but those who have experienced abuse, significant losses, or other adverse life events are at a higher risk. Anxiety disorders are closely linked to physical health. Many of the physical symptoms of anxiety, such as tension and nervous system hyperactivity, are also known risk factors for conditions like cardiovascular disease. Similarly, people with these physical health conditions may also develop anxiety disorders due to the challenges of managing their illnesses. Effective prevention strategies include parental education and school-based programs that enhance social and emotional learning and teach positive coping mechanisms to children and adolescents. Exercise programs have also been shown to be effective in preventing anxiety disorders in adults. Diagnosis and treatment. The good news is that there are several effective treatments available for anxiety disorders. Psychological interventions, such as talk therapy with professionals or supervised lay therapists, are essential in managing these conditions. These interventions help individuals learn new ways of thinking, coping, and relating to their anxiety, others, and the world around them. They can also teach people how to face and manage the situations or triggers that cause their anxiety. Psychological interventions can be provided individually or in groups, in person or online, and even through self-help manuals, websites, and apps. The most evidence-based interventions for a range of anxiety disorders are those rooted in cognitive behavioral therapy principles, such as exposure therapy, where people learn to confront their fears. Learning stress management skills, like relaxation techniques and mindfulness, can also help reduce anxiety symptoms. Additionally, certain antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs, can be useful in treating adults with anxiety disorders. However, healthcare providers should consider potential adverse effects, the availability of interventions, and individual preferences when prescribing these medications. Benzodiazepines, which have historically been prescribed for anxiety disorders, are generally not recommended due to their potential for dependence and limited long-term effectiveness. Self-care and support. Self-care plays a crucial role in managing anxiety disorders. Here are some strategies to help manage symptoms and promote overall well-being. Avoid or reduce alcohol consumption and steer clear of illicit drugs, as these can worsen anxiety. Engage in regular exercise, even if it's just a short walk. Maintain regular eating and sleeping habits, and adopt a healthy diet. Learn relaxation techniques like slow breathing and progressive muscle relaxation. Develop a mindfulness meditation practice, even if it's just a few minutes each day. WHO's role and initiatives. The World Health Organization, WHO, has developed comprehensive plans and programs to address mental health conditions, including anxiety disorders. Their Comprehensive Mental Health Action Plan 2013 to 2030 outlines the steps needed to provide appropriate interventions for people with mental health conditions. Generalized anxiety disorder and panic disorder are priority conditions covered by WHO's MHGAP program. This program aims to increase services for people with mental, neurological, and substance use disorders by training non-specialist health workers to provide care. WHO has also developed brief psychological intervention manuals that can be delivered by lay therapists to individuals and groups. These interventions, such as the Problem Management Plus (PM Plus) manual, are based on cognitive behavioral therapy principles and have been shown to be effective for multiple mental health problems, including anxiety and depression. Additionally, resources like the Self-Help Plus (SH Plus) group-based stress management course and WHO's Doing What Matters in Times of Stress self-help book offer valuable skills to reduce anxiety and stress. Anxiety disorders are a significant global health concern, but with awareness, effective treatments, and supportive self-care practices, we can work towards managing and reducing their impact on individuals and communities.